What are we doing here in Dubuque today?
So today we sat down with some providers here and continued a conversation that we've been having across the state, talking to folks who are on the ground and who understand the impact and are dealing with the impact of Medicaid privatization. And so we heard today what we've been hearing from folks all across the state, which is that this is a true disaster, that people continue to fall through the cracks, that these providers are not being paid, that the process itself is very flawed, that people are not getting the care because of the flawed process, and that things aren't getting any better. And these providers indicated that if this continues, that we're going to have more providers who are going to go out of business, and we're going to have more people who are not going to get the care that they need and are not going to get the level of care that they need. And so it's just another great conversation that solidifies for me how important it is that we start bringing this privatization back under state control so that we can get a more efficient system that isn't costly to people who are under the system and isn't costly to the state.
So I know there's a few months before the election, a few months before, should you win, you would take office. I mean, is there any sort of plan in place yet for how you would maybe start bringing that back in? I mean, we heard from some providers today that there is a very pressing time element here. It's something you want to do carefully, but there's also the need for a little bit of alacrity there. Is there a plan at all being formulated?
So we did hear from the providers today very clearly and very loudly that they need some action as soon as possible. I thought it was very striking that they told us that they really think that we need some action taken as soon as possible, or they are going to struggle to provide these services, which are necessary to Iowans. And so what I could tell them is what we are committed to, and that is when we win this election, on day one we take office, we will start this process of bringing things back under state control. And we will bring the stakeholders, the providers, the people that are on the ground around the table so that we can find out exactly what we can do and need to do short-term and long-term in order to create the quality, predictable kind of health care that Iowans deserve in this state.